Today's session is basically with respect to the safety, and here in this session, basically I will call this as the most important session, irrespective of whatever is think or whatever you think that maybe pre-examination, examination, or post-examination, whatever is important. But as far as my views, I will say this pre-examination safety is most important topic in your laboratory, and this safety is concerned with us who are working in the laboratories. So safety of me, safety of my staff, safety of the personnel who are visiting the laboratory for various purposes, vendors, our third party suppliers, or maybe whoever are in contract with the laboratory. Patients are coming to the laboratory, their relatives, attenders, many of time their guardians are accompanying them. So this safety is related to the all the personnel who are visiting, working, transiently visiting the laboratory for any purpose. So it is concerned with the safety of all the personnel. And apart from that, we are also going to see in this session levels of biosafety. So there are one level, level one, level two, level three, and level four of biosafety. So those also we are going to see in this session. So this topic is more of narrative, and there may not be any much explanations. So please listen to all the narrations and all the slides carefully. If you have doubt anyways in between, you can put into the Q&A box. So first of all, safety in the laboratories overview. Personnel working in the laboratories may be exposed to risks from various chemicals, infectious materials, fire hazard, electrical shock, gas leak, and so on. The environment is also at risk of being contaminated by the hazardous material used and waste generated in the laboratory. So it is not only the safety of us whom we are working in the laboratory, but we are generating lot of hazardous material in our laboratory which can contaminate the environment and which will also cause an public health hazard. The laboratory should prepare their own safety manuals covering the hazards and their mitigation plan, train staff on them. Now, this is the most neglected manual in your laboratory. We have quality manuals, we have SOPs, we have operating procedures, management system manuals are there, but this is the most neglected manual. But as I mentioned, this is the most important part of your laboratory is the safety manual. So you should prepare your own safety manual considering the infrastructure and hazards which are available and which are present in your laboratory. It cannot be taken from some other laboratories or from whatever they are following. They may have different fire exit fire, and they may have certain different protocols, they may have certain different IWAT stations. So again, you should have your own safety manual covering all the hazards and their mitigation plan. Mitigation plan means how to reduce it or how to eliminate those hazards, and you have to train your staff on all those aspects. Policies should outline the use of sharp, disposal of bio-waste, reagents, sharps, and other waste generated in the laboratory in accordance with the local and national regulations. So, in accordance with the local and national regulations, whatever are guidelines there, whatever rules are there. So, basically, these are all, as you say, these are all regulatory guidelines. So, regulatory guidelines stands above all guidelines. You may have accreditation guidelines, you may have standard, you may have any other guidelines, you may be following some national, international guidelines, but regulatory guidelines stands above all those guidelines. So your national and local regulations stands above all other regulations. It is essential to train all personnel in standard precaution. A code of practice is a listing of most essential laboratory practices and procedures that are basic to good microbiological techniques. So this should be included in your laboratory practices and procedures related to the microbiological technique. Safety in laboratories therefore include protection of both the personnel and the environment. So it is not only your protection, but the protection of your surrounding, your environment, and your safe, your public. So all the laboratory personnel should be aware of the laboratory safety policies and procedures and follow these at all the times. Follow these at all the times. As I have already mentioned, consider all samples, all specimens to be infectious. Considering them infectious and considering them hazardous, you have to handle them. List of hazardous material used in the laboratory should be prepared. Apart from that, hazardous materials, chemicals, reagents, you may have certain uh, acids, alkalis, you may have certain glassware, sharp in your laboratory. So these are basically all hazardous materials. You will have some gas cylinders. These are all hazardous material and you should prepare an appropriate list of this hazardous material. Hazardous material should be accounted for on periodic basis. You have to see periodically. You have to audit them periodically, whether they are appropriately stored, whether they are appropriately handled, whether correct maintenance of those cylinders is done or not. So it should be done at appropriate intervals and periodic basis. iWash facilities should be available as standalone facilities or attached to the sink. So you may have a standalone unit of iWash facility or you can just attach to your sink provided that it should be accessible. Not like that it is located in somewhere corner and when there is a need, it is not possible to even reach there. So it should be within reach, it should be accessible and it should be known to everybody. And apart from that, you should know whether it is functioning or not because many times we have seen a beautiful iWash unit is there standing in one corner and when there is a need, we are finding out that there is no water supply itself. So you should maintain appropriate standalone or can be attached to the sink. Biohazard symbol should be used in all container equipment containing biohazardous materials. So this biohazard symbol, how it should be, I have included it at the end of this presentation. So I will tell you how it should be and what are the details you should mention below that biohazard symbol. It is not like a standalone biohazard symbol. You have just paste it. There are certain details which should be included along with the symbol. So I will explain you at the end of the session. Laboratory personnel should be thoroughly trained in managing fire, non-fire emergencies such as large spillage and gas leakages. So there are various type of emergencies can be there, various type of fire accidents can be there, and even non-fire emergencies. Spillages can be there, gas leakages can be there. Suddenly some reagent bottles can fail and can break into glasses and the reagent or the acid can spread all over the floor. So all those protocols should be available. Gas leakages can be there. Suddenly there can be very high concentration of formalin which can cause irritation of eyes, burning of eyes, may cause difficulty in breathing. So your staff must be trained in handling all those kinds of emergencies. It is not only one or two people should be trained. Everybody should be trained. I think in the first session somebody has asked, do we need to train all staff in CPR? Yes, you have to train all the staff in CPR. You have to train all the staff in handling all type of fire and non-fire emergencies. Adequate fire extinguishers should be readily available in the laboratory. Now there are various protocols. Fire extinguishers, you need sprinklers, you need dry sprinklers, or you need water sprinklers. So as per the guidelines, you should have appropriate fire extinguishers or sprinklers and your smoke detectors should be available in the laboratory. Accident, injuries, incident records of laboratory personnel should be maintained and reported to the designated authority. So this is also one of the important part. Whenever anybody is getting exposed to any type of chemicals or even if anybody is getting any type of sharp injuries, all those must be recorded and must be reported to designated authorities. The report should include description of the event, factors contributing to the event, and information on first aid and other healthcare provided. So whenever you are writing a report, means whenever you are creating the records for incident, what it should include. So here they are given straightforward guideline. You have to describe the complete incident. You should mention what was the first aid was given, why it has caused, what was the contributory factor, what was the underlying factors which contributed to this event, and whatever first aid or any other type of healthcare service which was provided immediately after the incident. The information can be analyzed periodically towards effectively controlling and preventing future events. Now, once you record it, you should analyze it. periodically, maybe once in a month. If something is occurring very frequently, you can analyze it once in a month, once in a 3 month, once in a year, as per your convenience, so that you can make effective control measures in your laboratory so that the recurrence can be avoided. So once you analyze, you can focus on that area and you can prevent the recurrence of those events in future. Records should be checked periodically even in the absence of fresh entries. So even if you do not have any new incidents for a long time, the previous records must be checked periodically. So why it should be checked? So that you will have an appropriate monitoring. What was the incident which were happened or which have happened in the past? So accordingly, there are new staff coming in your laboratory, new personnel are getting appointed. So on that basis, you can take appropriate measures, you can train those staff, and the future incident can be avoided. Do not chew gums, drink, smoke, or eat while working in the lab. Very common scenario. We have seen people sitting in the middle of the lab and drinking tea or smoking. Anyways, I don't think anybody is doing, but eating and drinking, I have seen many places. People are sitting in the middle of the lab and drinking and eating something like that. So, no, not at all. It is not advised or it is not recommended. Laboratory glassware should never be utilized as food or beverages containers. So this is one of the things also I have observed many places. Many a times you will have a microwave in your laboratory and maybe somebody has got lunchbox from home and now it has become cold, so they want to reheat. So they will use the microwave, they will use other glasswares in the laboratory. So strictly no, you should not use. I am telling all those incidents because I have observed, I have seen all these things. People are using glassware for reheating the food. People are using glasses, those bottles for taking tea and coffee. So all these things happens in the laboratory. So it is strictly no. Always wear appropriate clothing. Chemically resistant lab coats or aprons are recommended. So chemically resistant lab coat, very important point. Right now, please check whatever aprons or lab coats you are using in laboratory. Is it chemically resistant? Can it resist a strong alkali? Is it able to resist strong acid? Check it yourself. Handle needles, syringes, and other sharp carefully. Use self-sheathing needles wherever possible. So self-sheathing needles means basically these are the attached cap with the needles. So if it is possible, you should use as far as possible to avoid any type of needle injuries or sharp injuries. Dispose all sharps in an appropriate sharp container. So puncture proof container should be used, no other alternative. Do not dispose chemicals down the drain. So do not release water chemicals or water other liquids are there in your laboratory directly in the public drain. Most chemicals must be disposed or hazardous waste. So they should be disposed of as per the guidelines and regulations for hazardous waste. This practice should be implemented very strictly. So not only the biomedical waste, liquid waste, but even for other hazardous waste, chemicals should be discarded appropriately as per their protocol. So if you read their kit insert or if you read their pack insert, how this chemical should be discarded, they have given it. So you should use and you should read it and you should dispose of your chemicals as per those guidelines. Compressed gas cylinders should be secured to prevent them from being knocked over. Cylinders should be capped when the regulator is removed or not in use. So chaining of the cylinders. So if you have cylinders in your laboratory, fix them because they should not fall down. They should not fall down. Even if it is a single cylinder, if there are 2 or 3 cylinders, chain it or do whatever so that they should be fixed at one place. You can have some beautiful stand so that they will remain always in your laboratory and there will be no chances of falling down. In the event of chemicals splashing into eyes or your skin, immediately first flush the affected area with running water for at least 20 minutes per eye wash facility. So straightforward here, there's one. If you have exposure to any of the chemicals, any of the mucosa, skin or eyes, flush it with a running water for at least 20 minutes. It should be flushed. Laboratory safety chemical hygiene plan is created to protect laboratory workers from harm due to hazardous chemicals. So as I have already mentioned, safety data sheet should be available, how to handle those chemicals, how to store it, and how to use it, and finally how to discard it. The chemical hygiene plan is a written document stating the policies, procedures, and responsibilities that protect workers from the health hazard associated with hazardous chemicals used in that particular workplace. So here itself, they are straightforward mention what should be included in the safety chemical hygiene plan regarding your policies, procedures, and responsibilities for handling of these chemicals so that they can use those documents for their safety. The content of chemical hygiene plan was established directly from the requirement of the laboratory standards and includes the following. So what information it includes SOPs relevant to the safety and health consideration related to the use of hazardous chemicals in the laboratory. So there should be standard operating procedures for handling of these hazardous chemicals. Identification of hazards and mitigating their strategies. So what are the different hazards are there with respect to each specific chemical? Some are related with the inhalational hazards, some are related with the direct contact with the chemical, some are related with the remote contact with the chemical. So every chemical will have different hazards, so all those must be identified and there must be mitigating strategies. So how you can avoid it? Mitigating means, again I am telling how to avoid it or reduce those exposures. Control measures to reduce individual exposure to chemicals. So there should be appropriate measures how a single person exposure can be reduced. Now for this I have very good example. Considering the formalin in your histopathology, we have seen the grossing area is the closed cabin where the grossing is done with a running formalin. Now, the exposure to each individual should be restricted. So, not only one person should be put continuously on this uh, grossing duties. The duties are the rotation, there should be appropriate rotation of the staff personnel who are working in this grossing area so that the exposure will be limited or can be reduced for each individuals. Provisions for medical consultations and examinations, this should be available. So even if you have some standalone lab or you are working in a single laboratory, you should have appropriate facilities very nearly located to your facilities so that whenever it is required, appropriate medical consultations and examination should be made immediately available. Laboratory procedures to be followed in case of any accident emergency shall require prior approval before implementation. So, if any type of procedures you want to implement in your laboratory with respect to the emergency protocols or with respect to the accident handling of the event, you may require appropriate approvals because these events or these procedures may have their inbuilt hazards. So, before getting or before implementing them, you should have appropriate approvals from your laboratory management. Provisions for additional personal protections for work with carcinogens, reproductive toxins, chemicals with high acute toxicity known as particularly hazardous substances. So those chemicals which are particularly known as hazardous, those should have appropriate protections. Like I have given already example of formalin. Formalin is a very strong carcinogen. So there should be appropriate protection from these carcinogenic factors or whatever related other chemicals are used in the laboratories. Measures to fulfill the requirement that fume hoods and other protective equipment functions properly. So you should check functioning of your biosafety cabinet, other hoods, so that whatever fumes are generated, it can be immediately sent out of the laboratory. So there should be appropriate outlet, there should be appropriate strong exhaust, hood should be there that can suck this hazardous fume and can just send out of your laboratory. So whether they are functioning or not appropriately, whether whatever requirements are there with respect to HEPA filters or any other type of filter, those should be appropriately checked. Their functioning should be appropriately checked on periodic basis. Laboratory hygiene and sanitation deal with basic upkeep, tidiness, and maintenance of a safe journey. So very important part, laboratory hygiene. Right from cutting your nails or trimming your nails of the hands, tying your hair. Many of the women working in the laboratory, they will have long hair. So the basic sanitations and hygiene include that the hair should be tied up properly. Even the male staff, they should not unnecessarily grow up their hairs or even their beards. So they should take appropriate personal hygiene should be maintained. Laboratory area should have restricted access. So this we have seen already in the infrastructure. There should be restricted access. Not everybody should be allowed to enter the laboratory. Visitors, children should not be allowed to enter the testing area. Very strict. No work. Why visitors and children have to enter those areas? Should be strictly restricted. Laboratory personnel should follow safe hygienic practices which include hand washing, wearing protective clothing, gloves, and eye protection. As and when required or as and when necessary, you should follow those safety hygienic practices. Workplace cleaning should be done before starting and after finishing work daily with sodium hypochlorite or equivalent material. Now, this is again a very important part. We have seen many laboratories function round the clock, 24/7. Then, when they should clean the workbench, even if there is no starting or there is no ending of their work, because since they are working 24/7, you should practice cleaning of the workbench every 8 hours, cleaning of the your work areas with appropriate disinfectant or hypochlorite or any equivalent material, maybe 70% alcohol can be used. So whichever is applicable or whichever is suitable. So not every places hypochlorite will be suitable. Not every all places your alcohol will be suitable. So you should see which is appropriate for your working area, and cleaning practices of your workbench should be followed on regular basis. Equipment should be cleaned every time before starting and after finishing work. Again, we have seen many auto analyzers keep on running around the clock. Then when you are starting and when you are finishing the work, there is no start, there is no end to work. But you should make a practice that every 8 hours or every 10 hours or maybe every 12 hours, whichever is appropriate or whichever you feel is feasible from your side, the cleaning of the equipment should be done. Basic biomedical safety training should be given to housekeeping so that he or she must be aware of lab waste and working materials. So housekeeping staff, they are not the laboratory staff, but they should be given basic training. Actually, what can be the hazards available, how to handle these materials, how to handle these waste, how to handle some of the laboratory hazardous chemicals. So they should be given basic training so that whenever they are posted in your laboratory or whenever they are working in your laboratory, they will take all those precautions while handling these chemicals and hazardous materials. They should be protected against tetanus. So again, they should be protected against tetanus means you have to give them vaccinations. Effective pest control should be exercised. Now, why effective pest control should be exercised? To avoid damages to your equipment, to avoid damages to your papers and records and chemicals. Effective pest control must be done. All lab staff handling samples should be vaccinated against hepatitis B and titers measured to ensure effective protection. So all lab staff, now many times we see why I have to vaccinate, why because guideline doesn't suggest to vaccinate the staff, but to ensure their safety and effective protection, you must vaccinate whoever is working in the laboratory for hepatitis against hepatitis B. And not only vaccination, it is not like that you have given the 3 dose and your job is finished. You must see whether the appropriate or sufficient titer has developed or not, because there are certain patients or due to our genetic makeup, many people are non-responders. Non-responders means even if you put all the 3 doses of hepatitis B vaccine, the titer may not develop or the titer may not rise. So you should know who are the non-responders. For that purpose, titers must be measured to ensure that they are effectively protected. So not mere vaccination will protect them, but you should also know the titer of to ensure that they are effectively protected. Coming to the personal hygiene, never smell, inhale, or taste laboratory chemicals. Very common. Don't smell anything, don't inhale, or don't try to taste whatever is available in chemical laboratory. Always wash hands with soap and water after removing gloves and before leaving the work area. So this is also very simple and very common thing. Washing, hand washing, there is a specific hand washing technique. We should use that hand washing technique. Always wash hands with soap and water after removing the clothes and before leaving the work area. Never eat, drink, chew gums, tobacco, smoke, or apply cosmetics in the laboratory. So don't apply any cosmetics also in the laboratory. So that also you have to follow, because yeah, cosmetics are basically certain chemicals. So they may react with any chemicals in your laboratory. It may cause certain reactions or allergies. Remove personal protective equipment such as gloves and lab coats before leaving the lab. So do not roam throughout the laboratory or throughout the premises, throughout your organization wearing your gloves and lab coat as it is. You should leave your lab coats and gloves before leaving the laboratory. Remove gloves before handling common items like phones, instruments, doorknobs. Again, very useful and very simple practice to handle the phones, instruments, and doorknobs, because many people are touching it. So you should not use it, or you should not open the door using gloves. Do not block emergency showers, eye washes, exits, and hallways. So many times I have come across some laboratories very congested, very cramped. Then what they will do, they will just put some material, some items, some store items in front of emergency exits or near some shower. So it is not accessible. So there is no use. Even if you have any eye wash or even if you have any emergency shower, if you are blocking it, then it is of no use. So precautions must be taken not to block any of these facility. Electrical safety, coming to the electrical safety helps prevent the misuse of electronic instrument, electric shocks, other injuries, and ensure that any damaged equipment, cords, or plugs are reported to the appropriate authorities so that they can be repaired. So do not wait till any accident happens in your laboratory. If there are any exposure or hanging wires, any type of exposed copper wires, immediately inform to the concerned authorities so that they can repair it or rectify it. Earthing check to be done annually. So you must check the earthing of your laboratory annually, or even more frequently if you are making any changes, if you are including any equipment, if you are changing any equipment, if you are making any alterations in your electrical fitting, earthing must be checked. Make sure all the electrical panels are unobstructed and easily accessible. So again, electrical panels, to complete any type of work or to perform any type of repair or any type of maintenance, it should be easily accessible and unobstructed access should be there. Wherever possible, avoid using extension cord. Very common practice we have seen in laboratories. The plug point is somewhere and then you have to take the connection from one part to another. Then you will use one extension box. Avoid all type of extension boxes and extension cords. Avoid all type of hanging and loose wires in the laboratory. Biosafety precautions. Now coming to the biosafety precautions. So as I mentioned, we are going to see level 1, level 2, level 3 and level 4 biosafety levels. Biosafety levels designation are based on composite of the design features, construction, containment facilities, equipment, practices, and operational procedures required for working with agents from the various risk groups. So these are basically the categories or facilities: level 1, level 2, level 3, level 4, depending upon the criticality, seriousness of the infections, the equipments which you are using, and what are the hazards and risks they can cause to your body. Depending upon those hazards and risks, these biosafety levels have been categorized. So risk group 1, where there is no or low individuals with community risk, a microorganism that is unlikely to cause human or animal disease. So these will be coming under the risk group 1. So we have, as I have mentioned, we have 4 risk groups. So first risk group is organisms that is unlikely to cause human or animal disease. Risk group 2, moderate individual risk or low community risk. So first is no individual or low individual risk and community risk. Now here you have moderate individual risk but low community risk. It includes pathogens that can cause human or animal diseases but is unlikely to be serious hazards to the other laboratory workers, communities, livestock or the environment. So it may cause any disease or in human or animal, but It may not cause any serious hazard to the laboratory workers or other environment or public hazard or any type of livestock. So this is risk group 2. Laboratory exposures may cause serious infections, but effective treatment and preventive measures are available. So this will also be categorized as risk group. So even if they cause any serious infections, the effective treatments are available and preventive measures are available to limit the spread of the infection. So this will come under risk group 2. Now coming to risk group 3, here high individual risk and low community risk. So the pathogens that usually causes serious human or animal disease but does not ordinarily spread from one infected individuals to another. So there may not be any contagious spread or community spread, but it can cause serious human or animal diseases. And effective treatment and preventive measures are also available for this risk group also, and risk group 2 also we have seen there are effective measures available for treatment and preventive measures are also available. Now coming to the risk group 4, high individual and community risk. For yourself, persons working in the laboratory, yourself also is have also high risk and community also has high risk. What will include in it? A pathogen that usually causes serious human or animal disease that can be easily readily transmitted from individual to another and directly or indirectly. Effective treatment, preventive measures are not usually available. So we have seen level risk group 1, risk group 2, risk group 3 and risk group 4. Risk group 4 is where there is a effect, there are no effective measures for prevention, there are no effective treatment, and the transmission can occur from one individual to another individual very easily, directly or indirectly. The backbone of the practice of biosafety is the risk assessment. So you have to assess the risk. The backbone, as I have mentioned here, the backbone of practice of biosafety is the risk assessment. So here we have assessed the risk. Risk group 1, risk group 2, risk group 3 and risk group 4. Depending upon the risk, you have to have appropriate measures or practices should be followed. The laboratory director or principal investigator. Now why this principal investigator keep on coming every time? Because in first class itself I have mentioned that these guidelines are available to all type of research laboratories also. So these principal investigators are working in the research laboratories, so this will keep on coming. The laboratory director or principal investigator is responsible for ensuring that adequate and timely risk assessments are performed and for working closely with the institution safety committee and biosafety personnel to ensure that appropriate equipment and facilities are available to support the work being considered. So whichever work is considered you are performing, depending upon the risk level, you must assess those areas, and with the help of your safety committee, with the help of your institutional policies, institutional protocols, with the help of appropriate equipment and facilities, you should be able to minimize the risk or to eliminate the risk in those areas. Once this risk assessment is performed, should be reviewed routinely. It is not like that you have done once and your job is finished. You should assess the risk because you have implemented some measures for risk mitigation. Whether those measures are in place, whether they are useful, whether they are effective, that you have to review. So you must review this risk assessment on periodic basis and revise when necessary, taking consideration the acquisition of new data having bearing on the degree of the risk and other relevant new information from the scientific literature. So the organism which is considered today as non-lethal can be, there can be some mutations, there can be certain new strains which can be lethal. So considering the scientific literature, the risk assessment should be done periodically and must be reviewed. Depending upon that, you should have appropriate biosafety measures should be available in your laboratory. Classifications of ineffective microorganism by risk group. So diagnostic and healthcare laboratories. Here we are addressing public health, clinical and hospital-based laboratories. All should be designed for biosafety level 2 and above. So for handling the microorganisms, diagnostic laboratories and other laboratories related to the public health, clinical setup and hospital-based setup, all the laboratories must have at least biosafety level 2 and above. So biosafety level 1 for microorganism in any laboratory is not at all recommended. It should be biosafety level 2 and above. As no laboratory has complete control over the specimens it receives, laboratory workers may be exposed to organisms in higher risk group than anticipated. So because there is many times there is a transfer of staff, there are mixing of the specimens here or there are traveling of peoples are moving here, equipments are moving, reagents are moving, your documents are moving. So considering all these aspects, you cannot say that this staff or this person is not exposed or it is not possible to get the exposure to some type of infection. So considering this, laboratory workers may be exposed to organism in higher risk categories also. So here is a summary of biosafety level requirement. As I have mentioned, we have level 1, level 2, level 3 and level 4. So these are various criteria. Isolation of the laboratory in level 1 is not required, level 2 is not required, but for level 3 and level 4 is required. Rooms, sealable rooms means if there are any chance of contamination. So for decontamination, you should be able to seal the room. So for biosafety level 1 and 2, you did not have to have sealable rooms, but for biosafety level 3 and 4, you should have sealable rooms. Ventilations for biosafety level 1 is not required. For level 2 is desirable. For 3 and 4, it is must. It is required. Inward airflow is required. Controlled ventilated system is not required for level 1, is desirable. So if it is available, it's well and good. Even if it is not available, it's fine for level 2. For level 3 and level 4, yes, it is mandatory. HEPA filters are mandatory in level 3 and level 4 biosafety levels. Double door entry, level 3 and level 4 is mandatory. For level 1, level 2, it is not mandatory. Air locking doors or air locking for level 1, level 2, level 3 is not mandatory, whereas for level 4 biosafety candidate, biosafety levels, it is mandatory. Airlock with shower. With shower, you must have seen in some movies this sophisticated airlock. So once you enter from one area to another area before entering this biosafety level 4, there will be one airlock and then there will be some shower coming over your body. So it is mandatory for level 4 biosafety cabinet. Then enter room is again mandatory for level 3, for level 4 is not applicable. Ante room with shower is mandatory for level 3, is not mandatory for any of other biosafety level. Effluent treatment, again it is mandatory for level 4, for level 3 it may or may not be available or possible depending upon the microorganisms you are handling. Then on-site autoclave must be available for level 3 and level 4 biosafety levels. For level 2, it is desirable. In laboratory area room, autoclave in laboratory room is desirable for level 3 and mandatory for level 4. Double-ended autoclave is desirable for level 3 and mandatory for level 4. Biological safety cabinets are desirable for level 2, mandatory for level 3 and level 4. Personal safety monitoring capabilities are desirable for level 3 and mandatory for level 4. So you can see the complexity of biosafety level as it goes on increasing. The infrastructural requirement and facility requirements goes on increasing and becomes more strict. So see in whichever capacities you are working, mostly as I have mentioned, this is related to the microorganisms or microbiological area. So look whichever facilities you are working, at what biosafety your level you are working, and whether this all facilities and is available at your location. So basic laboratories, as I have mentioned, biosafety level and 2, what is the code of practice? This code is a listing of most of the essential laboratory practices and procedures that are basic. In many laboratories and national laboratory programs, this code may be used to develop written practices and procedures for safe laboratory operations. So this basic code of laboratory safety practices in level 1, in level 2 can be used for to develop your practices and procedures in a safe laboratory operations. Access, as per the international Biohazard warning symbols and sign. As I mentioned, I will discuss this symbol at the end. Must be displayed on the doors of the rooms where microorganisms of risk group 2 or higher risk are handled. So, whenever there are risk group 2 or higher is are available and those organisms are handled, you should have this biohazard warning and symbol sign must be available on the doors before entering into those rooms. Only authorized personnel should be allowed to enter the laboratory working area, irrespective of the levels. Biosafety level 1, 2, 3, 4. Only authorized personnel should be allowed to enter. Personal protection, laboratory covers all gowns or uniform must be worn at all times for work in the laboratory. So whenever you are working in the laboratory for level 1 and level 2, you should wear gowns and uniforms whenever working in the laboratory environment of level 1 and level 2 biosafety. Appropriate gloves must be worn for all procedures that may involve direct or accidental contact with blood, body fluids, and other potentially infectious material or infected animals. So whenever you are working in biosafety level 1 and level 2, where there can be chances of accidental exposure to blood or body fluids, you must wear appropriate personal protective equipment. After use, gloves should be removed aseptically and hands must be washed. So this is regarding personal protections. Personnel must wash their hands after handling infectious materials and animals before they leave the laboratory working areas. Again, same, it is repeating, you should wash your hands before leaving the laboratory area. Safety glasses, face shields, or other protective devices must be worn whenever it is necessary to avoid the exposure to any microorganism. Eating, drinking, smoking, applying cosmetic, handling contact lenses is prohibited in the laboratory working areas. Storing human foods or drinks anywhere in the laboratory working areas is prohibited. So this again I have come across in many places. You will see the food, ice cream is stored in the laboratory fridges and all that. So please avoid all those things. It is not at all recommended or basically it is a prohibited. Laboratory working areas, laboratory should be kept neat, clean, free from materials that are not pertinent to work. So do not keep any unnecessary things in your laboratory working areas. So maybe you are carrying your laptops or any other things. Don't carry it at least in your laboratory working areas or processing areas. Work surfaces must be decontaminated after any spill of potentially dangerous material and at the end of the day's work. So again, there should be appropriate decontamination of workbenches and surfaces, whether it is any spillage or not. But at the end of your work, at least you should clean it appropriately. All contaminated materials, specimens, and cultures must be decontaminated before disposal or cleaning for the reuse. So, any type of material, reusable materials, if it is there, it should be appropriately decontaminated before reuse, or your media or specimen must be decontaminated before disposal or before discarding those specimens. Design features, the laboratory should have following design features. Ample space must be provided for the safe conduct of laboratory work for cleaning and maintenance. Not your laboratory should be very crampy and all the equipment and machineries and everything is put at one places. There should be ample space. So now many a times we see that people keep asking how much space is required. Ample space is required. Okay. Ample space is required for safe conduct of laboratory work for cleaning and maintenance. Walls, ceiling, floor should be smooth, easy to clean, impermeable to liquids, resistant to chemicals, disinfectant normally used in the laboratory. So do not use any type of materials which are which can be easily get damaged. So all your walls, ceiling, and floor should be very smooth, imporous material so that the cleaning becomes easily. Floor should be slip resistant. Bench top should be impervious to water and resistant to disinfectant, acid, alkalis, organic solvents, and moderate heat. So your bench top should be designed in such a way they are impervious so that maybe some dust particles or some microorganisms should not hide into all those places, and it should be resistant to your disinfectant and acids, alkali. Otherwise, you are disinfecting and it is getting damaged. So it should be resistant to any type of disinfectants, acids and alkalis and solvents. Illumination should be adequate for all the activities. Undesirable reflection glare should not be. So any type of different colors of lights and all those, these are not at all recommended in your laboratories. There should be adequate illumination. Hand washing basins with running water, if possible, should be provided in each laboratory room, preferably next to exit door. So before exiting, you should be able to wash your hands. So wash basins should be available in your working area near to your exit doors. Doors should have vision panels, appropriate fire rating, and preferably by self-closing. So it should be not like that. The door needs to be closed manually. So they should be, it is preferably should be self-closing. So you might have seen many places those doors are there. Once you open it and enter or exit the room, it closes automatically. So those type of self-closing doors should be available. Biosafety level 2 and autoclave or other means of decontamination should be available in appropriate proximity to the laboratory. So it should be available within your laboratory area. Not like that the laboratory is at one place and after maybe in some another building you have kept the biosafety cabinet. It is not at all recommended. It should be in the your close proximity of your laboratory. Safety systems should cover fire, electrical emergencies, and emergency shower facilities. These are all important things which should be available in your laboratory. In the planning of new facilities, consideration should be given to the provision of mechanical ventilation system that provide an inward flow of air without recirculation. So basically, you should have appropriate air handling unit so that the circulation of air is appropriate. So there should not be any what we call manual ventilation. So everything should be mechanical ventilation. So if you have appropriate air handling unit, it will help for the circulation of the air. If there are no mechanical ventilation, windows should be able to be opened. So if you do not have appropriate ventilation, then you should have windows that can be opened whenever it is required in case of emergencies. A dependable supply of good quality water is essential. There should be no cross connections between source of laboratory and drinking water. Segregated drinking water should be separated from your laboratory water and good quality of water should be available for both the purpose. There should be a reliable and adequate electricity supply, emergency lighting to permit safe exit. So there should be a glowing path or any type of reflections should be available whenever there are dark or to have safe exit in case of emergencies. Adequate electrical supply should be available. Backup should be available. Online UPS with backup from your generator as per your requirement of the laboratory. Good maintenance of the installation is mandatory. Physical and fire security must be considered. Other measures should be considered and applied as appropriate. Equipment should be selected considering the following: designed to prevent or limit contact between the operator and the infectious material. So it means that there should not be a much contact with the operator and the infectious material. So you should select equipment which are preferably automated and there is less handling of the specimens. Constructed of materials that are impermeable to the liquid, resistance to corrosions, and meet the structural requirements. So even your equipment, you should see they should not be of the ordinary plastic or ordinary materials. The materials should be liquid resistant and corrosion resistant and should have meet the requirements of structure. Fabricated to be free of burrs, sharp edges, and unguarded moving parts. So there should not be sharp corners, sharp linings, sharp edges, so that which itself can cause injury to the personnel working in the laboratory. Designed and constructed and installed to facilitate simple operations, provide for ease of maintenance, cleaning, decontamination, and certification testing. Glassware and other breakable materials should be avoided wherever possible. So this is regarding with your equipment. They should be appropriately designed so that they can be designed appropriately, constructed and installed to facilitate simple operations. There should not be any complicated operations and ease of maintenance should be there for cleaning as well as decontaminations. And as far as possible, try to avoid glasswares and other breakable materials. So I think that day somebody has asked me that whether glass tubes can be used for citrate coagulation studies. Yes, you can use, but as per this, try to avoid glassware because if it breaks, it can cause damages and it can cause injuries. Health and medical surveillance, the employing authorities through the laboratory director is responsible for ensuring that there is adequate surveillance of the health of the laboratory personnel. Surveillance of the health of laboratory personnel means there should be appropriate health checkup for all the laboratory staff should be performed. It is not a desirable requirement. It is a mandatory requirement. You should perform the health checkup of all the laboratory staff working in the laboratory. The objective of such surveillance is to monitor for occupational acquired diseases. And what type of surveillance or what type of testing will be done? Not like something routine urea creatine you have done, and for namesake you have performed some health checkups. There should be appropriate surveillance to monitor for the occupational acquired diseases. Okay. So your health checkup program for your laboratory staff should include screening of the occupationally acquired diseases, whichever is relevant in your working areas. Guidelines for surveillance of the laboratory workers handling microorganisms at biosafety level 1. So here guidelines also has given what are the surveillance guidelines are there. Historical evidence indicate that microorganisms handled at this level are unlikely to cause human diseases or animal diseases of veterinary importance. Ideally, however, all laboratory workers should undergo pre-employment health checkup at which their medical history is recorded. So, recording a basic history is important for pre-employment in biosafety level 1. Guidelines for the surveillance of the laboratory workers handling microorganisms at level 2 includes pre-employment health checkup is necessary. The person's medical history should be recorded and a targeted occupational health assessment performed. Targeted occupational health assessment means any particular occupational hazard which is related to the working area should be screened specifically. Records of illness should be kept by the laboratory management. So if there are any illness or any health hazard due to the occupational health, those records must be kept by the laboratory management. Women of childbearing age should be made aware of the risk to an unborn child of occupational exposure to certain microorganisms such as rubella. We know exposure of rubella or infection of rubella can cause certain effect on or are risk to the any unborn child. The precise steps taken to protect the fetus will vary depending upon the microorganisms to which the women are exposed. So it may vary depending upon the microorganisms they are getting exposed. Waste handling, waste is anything that is considered to be discarded. So laboratory decontamination of the waste should be there as per the appropriate guidelines. And in terms of daily use, few if any contaminated materials will require actual removal from the laboratory or destruction. So you may require to remove some materials from your laboratory as a part of discarding facility. There overriding principles in that all the infectious materials should be decontaminated, autoclaved or incinerated within the laboratory. So before discarding, all the materials must be decontaminated, autoclaved and incinerated. Decontamination steam autoclaving is preferred for decontamination purpose. Materials for decontamination and disposal should be placed in a container, autoclavable bag, and then only it should be decontaminated. It should not be openly decontaminated. Handling and disposal procedures for contaminated handling and materials is identification and separation system for infectious materials and their containers should be adopted. National and international regulations must be followed as a part of decontamination and appropriate monitoring of decontamination conditions should be done. Categories should include not contaminated waste that can be reused or recycled or disposed as general household waste. Contaminated sharp hypodermic needles, scalpels, knives, broken glass should always be collected in a puncture-proof containers, fitted with covers, decontaminated by autoclaving, and then it must be disposed of. Here, the code of practice for level 2 and level 1 level 2 applies, except the international hazard warning signs and symbols must be displayed in the laboratory area access doors and must identify the biosafety level. So you must identify the biosafety level at the door itself. There should be appropriate sign. The name of the laboratory supervisor who controls and access indicate any special conditions for entry into the area. So if there are any specific area are required where a specific immunization is required, it must be under the supervisor control so that they can monitor and they can control the access of personnel who are entering those laboratory area. Open manipulations of all potentially infectious materials must be conducted within the biological safety cabinet. So wherever you are handling the infectious materials, it should be done in an appropriate biosafety cabinet. Respiratory protective equipment must be used or working with whenever you are working with infectious materials in the laboratory. Laboratory protective clothing must be of type with solid front and wrap up gowns, scrub suits, overalls, and coveralls and head covering where appropriate. Shoe covers and dedicated shoes should be available. So
These are the type of PPEs we should use in our laboratory while handling the microorganisms. Laboratory designs and facilities. The laboratory must be separated from the areas that are open to unrestricted traffic flow within the building. So there should be a segregated area as far as laboratory is concerned, especially when you are handling microorganisms. It should not be easily accessible, and it should be segregated from other areas of the your institute. Additional separations may be achieved by placing the laboratory at the blind end of the corridor or constructing a partition door or access through an anteroom or describing a specific area designed to maintain the pressure differential between the laboratory and its adjacent space. So pressure differential means negative pressure, positive pressure, whichever is recommended can be maintained, and if possible, laboratory should be designed at the end of corridor. Microbiological laboratories where the infections are handled, it should be designed at the end of the corridor. So here are some guidelines if you are interested to design some laboratory. These are the guidelines you can follow while designing the contaminant laboratories. The anteroom should have the facilities for separating clean and dirty clothing and preferably a shower. So anterooms are basically the rooms which are placed before entering the actual laboratory. So you should have appropriate facilities for separating clean and dirty clothing. There you should be able to change the clothes, and if possible required or if required, you should take appropriate shower and bath before entering the laboratory. Entrance doors must be self-closing and interlocking. This also we have already seen that of the rooms, doors must be self-closing and self-locking. A breakthrough panels may be provided for emergency exit use. So in case of any emergencies or in case of any fire accident, a break panel through panels should be provided, which can be used at the time of emergencies. Surfaces of walls, flooring should be water resistant and easy to clean. Openings through these surfaces should be sealed to facilitate decontamination of the room. So if there are service line, drainage lines or plumbing lines are there, the openings and closings should be appropriately sealed so that there will not be any cross contaminations of those areas. The laboratory must be sealable for decontamination. So if you want to decontaminate the area or the laboratory, there should be appropriate sealable facility. So that area should be completely sealed when you are going to decontaminate those areas. Air ducting system must be constructed to permit gaseous decontamination. So if you are conducting any type of gaseous decontamination, any type of mm, fermentation, those type of ducts, air ducts must be available to provide appropriate decontamination in the containment zone or containment area of your laboratory. The building ventilation system should be constructed in a way that air from the contaminant laboratory biosafety level 3 is not recirculated to other areas. So if you are having a biosafety level 3 areas, please take a precaution that the air should not get circulated to other parts of the laboratory or other parts of the building. Air may be high efficient particulate air filtered, or that is HEPA filters should be used for reconditioning and recirculating within that laboratory. So you must use appropriate filters in your laboratory. For containment laboratory, an autoclave for the decontamination of the contaminated waste material should be available in the laboratory itself. Laboratory equipment includes biological safety cabinet of level 2. However, a biosafety level 3 is for handling of the infectious materials is recommended in the containment laboratory. Health and medical surveillance, biosafety level 3, except where medical examinations of personnel is necessary, and after a satisfactory clinical assessment, the examinee may be provided with medical contact card with photo and personal details. So all type of medical tests and screening must be done, medical examination must be done for the personnel who are being appointed in a level 3 biosafety areas. The maximum containment laboratory biosafety level 4, the maximum is designed for group 4 microorganisms. Before such laboratory is constructed, put into operation, intensive consultation should be held with institutions that have had experience of operating similar facilities. So if you are planning to design a level 4 biosafety laboratory in your institute, please talk to the expert or personnel who are working in other institutes or those who have already experienced while establishing this type of laboratory. Operational maximum containment laboratories should be under the control of national and other appropriate health authorities. So you have to keep those laboratories under the direct control of any national or appropriate health authority. We should take the control of level 4 biosafety laboratories. So these are repetitions. Then coming to the biological safety cabinets are designed to protect the operator, the laboratory equipment, work materials from exposure to infectious materials. So these are certain type of cabinets which are designed to avoid the direct exposure to microorganisms. Aerosol particles are created by any of the activity into liquid or semi-liquid materials such as shaking, pouring, stirring, dropping into liquid into surface or into another liquid. So other laboratory activities such as sticking agar plate, inoculating cell culture, flask with pipette using multi-channel pipettes to dispense liquid super suspension of the infectious agent in micro culture plate, homogenizing, vortexing infectious materials, centrifugation of infectious liquids, or working with animals can generate infectious aerosols. So these are all activities which can generate infectious aerosols. So all these activities must be performed in a biological safety cabinet. Aerosol particles less than 5 micrometer which are not visible to the naked eye and laboratory worker is generally not aware of such particles being generated and may accidentally involve. Biosafety cabinets with properly used have been shown to highly effective in reducing this acquired infection and should be used wherever the cross contaminations are suspected. So this is annexure 6 where we have categorized the biosafety level 1, 2 and 3 categories where the airflow, circulations, exhaust system, hard duct must be available in class 1, in class 2, exhaust to room and timber connection must be available in class 2 A2, exhaust again connection must be available in class 2 B1 hard duct, class 2 B2A hard duct and class 3A hard duct should be available and these are the phase velocities that should be circulated in your laboratory like 0.36 meter per second, 0.38 to 0.51 meter per second and these are the airflow in percentage. Recirculation in class 1 is not required, exhaust 100% is required, class 2A 70% is recirculated, 30 is exhausted, class 2A to 70-30, class 2B1 again 30% is recirculated and 70% is exhausted. For class 2B and 3A 100% should be exhausted. And this is the finally the biohazard symbol which I have mentioned which should affix at appropriate places in your laboratories and on the doors of the laboratories. Admittance to authorized personnel only. Biosafety level you have to mention here. Responsible investigator or the supervisor should be available. In case of emergency call, so a emergency contact number should be available and phone number, daytime phone number or home phone number. So if the person is not in place, whether you should contact. So a biosafety symbol with a warning sign should be available on laboratory doors with this appropriate information should be placed into those biosafety or biohazard symbols. So with this, we have concluded this session on safety in the laboratory.